Hi, this is Dr. Jim Anderson from Anderson Podiatry Center, here to talk to you about our innovative approach to treating your plantar fasciitis. A lot of you suffer from plantar fasciitis. You may be getting up in the morning, having a lot of pain on the bottom of the heel, hard time walking first thing in the morning. Maybe as the day goes on, you still have the problem. It doesn't go away. And for some of you, maybe it goes away a little bit, but you're afraid to go out for that run, afraid to walk a lot, because you're afraid you're going to pay the penalty the next day. And that's a real common complaint I hear. And some of you get so proficient, so good at favoring that heel, that you learn how to walk differently, and you'll start getting pain around your ankle, maybe up into your knee, and even into your back. You do it so well that sometimes your heel doesn't feel as bad, but other things hurt worse. So it's a very common complaint that we hear. And plantar fasciitis, you hear a lot about it. So many people are treating it. And I feel that we do a very good job here because we've really refined how we go about treating you with our regenerative way of treatment. So many of you are out there and you've tried all sorts of things. You see this on the internet, and maybe you've been to other doctors where they've talked about stretching. Maybe you've had physical therapy. Maybe you bought some over-the-counter orthotics. Maybe you've tried cortisone injections and they've helped for a little bit, but now the problem's back. Other treatments might be using night splints. Maybe you buy some gizmo that you roll your foot on at night and it's supposed to massage it. Maybe you've tried massage, maybe you've tried icing. So there's so many things that I hear that you're using to treat this. And many of you, these do work to a point, but it's as if you're managing the problem and you start to not be as demanding. You start to maybe not run as much or walk as much because you can kind of maintain it, but you're never back to where you really want to be. And so we like to feel here that we can optimize your improvement by approaching it from a little bit more scientific approach. So with our regenerative process, we use laser and we use regenerative medicine. We were the first in this area to use multi-wave laser treatment, which is very effective. And we're also the first in this area in Colorado, in my profession at least, to do a lot of the regenerative medicine treatment for the plantar fascia. And so the plantar fascia problem that you've heard about is not really so much of an inflammation if you really research this. It's really more of a deterioration of the fascia. And so when you first come in, you're going to be treated differently here. We do a really good exam, we take x-rays, and we'll use a high-resolution ultrasound diagnostically to actually look at your fascia. So we can tell from the very first visit, is this a mild case or is it a severe case? And customize our treatment based upon what we're seeing. So from day one, we are able to focus on this. And I feel we have an approach that gets this better faster. So you're not having to go through all these other treatment options over 6 months or a year. And you're just shopping around and you're coming into us 3 years later. So please give us the opportunity and learn about our regenerative process. And I would ask that you visit our website at andersonpodiatrycenter.com, or please give us a call. Thank you.